Hi everyone, my name is Marcela Jibaja and today I'm going to talk to you about asthma and athletes. Let me tell you a story. On August 2nd, 1992, Jackie Joyner-Kersee becomes the first woman ever to win 2 consecutive Olympic gold medals in the heptathlon. Born and raised in East St. Louis, Jackie Joyner overcame poverty and chronic asthma to win a scholarship to UCLA, where she starred on the basketball and track teams. In 1987, Joyner-Kersee won gold in both events at the Seoul Olympics. Asthma. What is asthma? Asthma is a disease that affects your lungs. It causes repeated episodes of wheezing, breathlessness, chest tightness, and coughing. It can be controlled by taking medicine and avoiding triggers. It has been shown that asthma is a complex interaction between genetic predisposition and environmental stimuli that results in various phenotypes of asthma. Allergens such as pollen, mold, animal dander, insect parts, and some chemicals trigger asthma, as well as irritants such as smoke, dust, gas, or diesel fumes and chlorine, which can trigger or exacerbate an asthma attack in individuals with increased airway hyperresponsiveness. Asthma affects 17 million people in the U.S. alone, including those with exercise-induced asthma, but with effective health management, many still live an active life and achieve their athletic goals. 1 in 12, about 6 million children in the U.S. ages 0 to 17 years have asthma. 50%. Asthma hospitalizations for children declined from 10% in 2003 to about 5% in 2013. 1 in 2. More than a half of all children with asthma had one or more attacks in 2016. This is the case of many people, including athletes, that have an asthma diagnosis. That is a prevalent condition with potential implications not only on their general health, but also on their competing performance. There is a list of athletes with asthma like David Beckham, soccer player, Jerome Bettis, football player, Amy Van Dyken, swimmer, and Jackie Joyner-Kersee, track and field athlete. They all were diagnosed with asthma when they were young and discovered that by controlling it, they could not only still participate in sports, but they could go on to accomplish great things. But what about the rest of us? Especially the children of minority families that are affected by the same illness. Asthma and Allergy Foundation of America report examines how asthma affects Black, Hispanic, and Indigenous population in the United States. Ethnicity is strongly correlated with socioeconomic status in the U.S., where members of certain ethnic groups, like African Americans and Puerto Ricans, are disproportionately represented among the poor. Because poverty has been associated with asthma and morbidity, and it has been postulated that the socioeconomic status is also responsible for ethnic differences in asthma and asthma morbidity. The effect of the socioeconomic status on illnesses such as asthma is likely mediated through pathways including environmental exposures, access to healthcare, stress, and psychological and cultural factors. However, ethnicity is also correlated with racial ancestry, which may influence asthma disparities through differences in the frequency of disease susceptibility allies. The purpose of this paper is to provide information about accessing community resources as well as school programs where the kids with asthma can have an active life and achieve their athletic goals. CDC's National Asthma Control Program works to help Americans with asthma achieve better health and improve quality of life. The report reviews the current state of asthma disparities and serves as a national call to action to fix the social inequalities caused by structural racism that continue to plague vulnerable at-risk patients and families with asthma. Over the past 15 years, there have been moderated advances in the U.S. public policy, healthcare, and research, but racial gaps in asthma outcomes have not changed. Minority groups continue to bear disproportionate hardship in managing asthma. The report reviews the current state of asthma disparities and serves as a national call to action to fix the social inequities caused by structural racism that continue to plague vulnerable at-risk patients and families with asthma. If we all want a healthy start so everyone can have an equal chance to succeed in life, then we need to start helping the less fortunate. Here are some of the resources I use for my document, and here's my contact info. Thank you.